This conference will now be recorded.
Are we good? All right, the time being, that's close enough to 7 o'clock. I'd like to call the October 7th, 2020 meeting of the Tilton Budget Committee to order. So before we get started, if you're participating by phone or the GoToMeeting platform, please mute your microphone during the meeting unless you want to speak. Otherwise, background noise will interfere with the meeting. The Budget Committee is meeting at Town Hall and providing access via GoToMeeting and conference call to enable the public to observe and listen contemporaneously to the meeting. Additionally, there is an opportunity for the public to attend the meeting in person. However, in order to maintain social distancing, only 8 spaces are available and attendance is on a first-come, first-served basis. Once the maximum limit has been reached, anyone wishing to participate in the meeting must do so remotely. If anyone has a problem with remote access to the meeting, please email web@tiltonnh.org, which will be monitored during the meeting. All right. I think next on our agenda is the Pledge of Allegiance, is it not? Yes. And salute our flag. All right. I pledge allegiance to the flag of the United States of
America,
Republic
with the same, one nation,
indivisible, with liberty and justice for all. Who is speaking?
Christine, I believe. Yeah. Flag on.
All right, we have minutes of, did we get into the record that our member Christine Dubinski is joining us remotely? That does make a quorum. All right.
I wasn't here, so.
Pardon?
I wasn't here for the minutes, so.
Yes.
Vote.
I haven't met these yet. I'm sure they're.
By the way, I go by Dick Olson, not Richard Olson. So make sure that's good for the record and for my name tag.
Okay.
Thank you. No Tim this time?
Pardon?
There's no Tim?
Tim is with us
Oh, he is.
downstairs and
Oh, the video?
monitoring the
Okay.
GoToMeeting.
I said, wow, okay, we got all this. There he is. Okay.
Oh,
I can't believe we got all this running without you. I was like, wow, real impressed for a second.
I'm here.
I make a motion to accept the meeting, minute meeting, excuse me.
Meeting minutes, yeah.
For a second.
Second?
All right. Any discussion?
I was not here. So.
Nope.
Okay, all those in favor, please signify by saying aye.
All right.
Aye. Opposed? Abstentions?
Hey,
3 yes, 1 abstention. All right, homework done.
Catherine, did
Yes.
Dick second that?
Yes,
He abstained. Can he second?
yes.
Okay.
Good question, though. All right. Outside agency presentation, and I believe Lakes Region Mental Health is up on our list. Oh, right over here. Okay, right here.
I feel like I have my back to people. I'm sorry.
It's okay.
Okay. My name is Ann Nichols. I'm the Director of Development for Lakes Region Mental Health Center. We have campuses in Laconia and in Plymouth. We're the community mental health center that serves the towns within all of Belknap County and Southern Grafton County. So there's 24 towns in total that we serve. There's 10 community mental health centers in the state of New Hampshire, and each one has their own geographic catchment area. We were founded in 1966, and overall, I would, without going into a whole lot of detail, we provide comprehensive, integrated mental health treatment for people who are living with and recovering from mental illness and or emotional distress. That also includes that we provide primary care services on site for patients who normally may not seek medical care because of their illness. Last year, we served 4,089 patients. That includes children. I think our youngest is 3. Our eldest is 92. And we provided over $1.2 million in charity care. And charity care is defined as services that were delivered, but for which we receive no reimbursement from any source. We are mandated by the state of New Hampshire to provide emergency services to every single town in our catchment area, and we do so regardless of the patient's ability to pay. In Tilton last year, we served a total of 165 residents, and that includes all of our programs. 35 of those were children under the age of 18. 110 of them were adults up to 61 years, and 20 were elders at 62 and above. We provided 41 of those individuals with emergency care services. And all in all, we provided the residents of Tilton with $40,392 in charitable care. Emergency services is the most costly program provided by Lakes Region Mental Health Center. It never will ever support itself just because it's incredibly expensive for us to operate the program. We have to provide psychiatrists, medical providers, registered nurse practitioners, as well as master level clinicians on call 24/7, 365. And so we serve 3 hospitals, Franklin being one of them with LRG Healthcare in Laconia and Spear Memorial in Plymouth. So just to give you an idea of what it costs to run this program, in last fiscal year, it cost us $1.1 million in order to operate the program. Now we received, I don't have my glasses on here. We received $576,000 in payments, and that would include self-pay, patients pay, self-pay, private insurance, Medicare, Medicaid. That leaves a deficit of over $580,000. So each year we go to all 24 towns and ask for support to help us reduce that deficit. We're not asking towns to reimburse us for charity care that we've delivered to your town. So there's a difference there.
So what, can you run those numbers back by me again?
Yeah, so we provide those services and it cost us $1,157,090 to run that program. We received payments of $576,422.
And what is that program?
This is emergency
Services
Yes.
program. Okay.
Yeah.
Costs you $1 million to run that.
Oh, yeah.
And how does that kind of break down?
Are you talking about in salaries and admin?
You just in general, like, is that just 100% the salaries and admin of like how many people, I would say? Like, it just
Oh,
kind of,
we-
and how many people is that serving? How many big of an area?
Yeah, we have like 6
It's
providers.
a pretty big number, that's all.
Yeah, we have like 6 providers.
Okay.
That includes our psychiatrists, nurse practitioners, and our clinicians that serve the ERs of the 3 hospitals.
Okay, so that would be covering 6 people's salary. Okay.
Yep. Yeah. So, and of course, the highest salaries are the medical providers.
Absolutely, yeah.
So I don't.
So they're all full-time then, at that point?
Excuse me?
Are they all, is this for each, you say it's 6 people, that's 6 full-time positions?
Yeah. A lot of the services can be provided through telehealth, which helps because it's not feasible to have a psychiatrist in all 3 hospitals all the time. So we use telehealth. We've been using that for 12 years to provide services for those that are presenting in the emergency room at the hospital, because they need to have an immediate intake to determine what's the proper next steps for us to take. Do they need voluntary hospitalization at the state? Do they need involuntary hospitalization? Or can we keep them out of the hospital, which is our goal, and try to get them on a longer term plan of treatment? So I don't know what questions you may have. I mean, you have the application, which is a pretty thorough application, but in looking through it, and plus I've been here for several years now, so you probably know what I'm going to say. But I don't know what questions in particular that you have as it relates to Tilton, as it relates to services in general, what happened during COVID, all of those.
So this, if we did not fund you, this wouldn't really affect you guys that much or at all with services?
Well, I won't say that it won't affect us. I mean, we are required by the state to provide those services, but we ask all 24 towns to help us reduce the deficit. Is it going to jeopardize the services that are delivered to Tilton residents? No, it won't. But we have asked for this support simply because we are providing direct services to residents of this town, and quite a few.
Okay. And I think you guys do a great service. We just got to remember that this is taxpayers' money. There's a lot of people that are retired here in Tilton. They're on a fixed income. We've increased the tax base a lot. I think this year it should be responsible, especially with COVID. A lot of incomes have been hit. So it is important to keep that in mind. So
Yeah,
that's why I bring up that, be super critical about that.
I understand.
So this wouldn't, at the end of the day, this, because you have a $13 million budget, looks like incoming budget working with, so $3,000 at the end of the day really wouldn't make or break any services, or really was just kind of a tiny drop in the bucket.
It is,
Okay.
but you know, collectively with all the towns, I ask for 152,000, and I usually get just under 118,000. This past year was 120 because one town increased its support, its dollar support from 750 to 3,000.
Okay.
So yeah, that's what the town portion. So of that $500,000 deficit, we're asking the towns to cover $120,000 of that.
You don't think that could be easily done with, smart fiscal spending inside the business, maybe cutting overhead in some way or another, or?
No, we're required by the state. We have regulations by the state that limits our overhead to no more than 10%. And for administration fees in particular.
Do you guys run right up to that 10%?
Yeah, we do. We do. I mean, we have 200 employees, so we're a fairly large employer between both campuses. And our reach is pretty far. I mean, we have clinicians in 9 local schools right now treating children. That was interrupted by COVID when everybody went virtual. And so in some schools, we're now able to see kids face to face in school. Other schools are doing a hybrid, so that makes it a little more challenging, but.
Sorry, I didn't mean to interrupt, but you said you had how many administration staff?
In total?
Yes. Out of this $13 million
I
that,
don't know that I have the answer for
Okay.
that right now. I mean, let me see if.
because it seems like to me, it just represented, maybe I'm just taking it wrong, but it's represented to me that your business is almost incentivized to go into the negative so then they can collect extra funds.
No.
So okay, that's all.
No. If we're going into the negative, that'll oftentimes disqualify us from being able to apply for certain grants.
Well, how did that, you go into the negative last year and then you came to us to ask for the surplus? So did it disqualify you from grants last year?
No, what happens is that the deficit can be made up partially from the towns and partially surplus that we run in different programs. So our children's program, for instance, is a very profitable program. So we usually make money on that program. In our housing for homeless adults, we lose money on that one. So when all is said and done, we look at each program. So this is not reflective of what the organization had for a deficit last year. It's just this particular program. Because we have quite a few different programs to serve different needs.
So one program wouldn't make up for other programs?
It
So
might,
okay.
yeah.
So
It might.
There's no way we can manage that at a better, or you don't think there's any way that you guys can manage as a big business the funds better to not have to ask towns for money?
No. The big issue here is that we have 19 openings right now. So the problem that we're struggling with right now is that the demand is exceeding our ability to provide services. COVID is creating a lot of that. We're holding our breath on what's happening to the children right now. We're expecting a huge increase in kids that are going to be needing services. So,
That's good for business for you then, right?
well, it is good for business, but keep in mind that almost 80% of our fee-for-service revenue comes from Medicaid. So understand the population that we're serving. There are a lot of people, and that's why we have $1.2 million in charity care. So, when you're looking at individual programs, yeah, one program can offset some of the losses in another program. We can do that, but our problem is unless we can hire more therapists and caseworkers that are revenue generating positions, then our hands are tied in terms of improving our financial performance. And the reason why there's a workforce issue is because there's not enough people coming into the profession. And being a case manager or a therapist, even with a master's level degree, your salary will be $35,000. It's not a lucrative career for people.
But we just,
So keep in mind that this is a national problem. It's not just Lakes Region Mental Health Center. There's not enough individuals.
and when you say
entering the mental
$35,000
health.
a year, is that for the doctors we were just talking about, the 6 positions?
What's that?
Is that the 6 position job we were just talking about for the hospital? When you said $35,000, $40,000 a year jobs?
No, these are clinicians, bachelor
Okay.
level, and
Just wanted to make sure that was clear, so.
even a master level case manager or a therapist will only make $35,000 to $40,000 a year. Physicians, on the other hand, are in 6 figures because they're physicians.
Absolutely.
So you can understand the difference. And most of our patients are served by clinicians that make $35,000, $40,000 a year. So if you're not hiring revenue producing staff because they're not entering the profession, then you can't generate more revenue.
When's the last time you guys actually did a net positive then?
Did a what?
Last time you guys actually made profit? Like and actually broke even? Or does every year do you have to go on the negative?
No, we've had years where we've had a surplus.
So when is that? When's the last time you guys had a surplus?
Last year we had a small surplus.
And you still ask towns for money?
Yeah.
Okay. Thank you.
John, any questions?
Yeah, as for the COVID, were you getting funding to help cover costs or that could be applied to? some
Well,
of
yeah,
your
but it
normal
didn't affect
expenses?
last fiscal year. So for COVID, we received the payroll protection program loan. It was 1.6 million. We don't know how much of that's going to be forgiven. So, we have assets to be able to pay it back if if that's what's required. We don't know because the Fed hasn't made those decisions. We received $52,000, which is a small percentage of the revenues we received from Medicare. And we received $238,000 from the long-term care fund, which is a wash. It's a stipend that we pay our workers because they're essential frontline workers. And then we are reimbursed. So it goes out and it comes in. So it's just a zero net. And that's it. I made mention in the application that we had applied to the Healthcare Provider Act for $209,000 grant, and that was denied.
Oh, really?
And
Why was that denied?
That was for, I don't know that. It was federal. It's been a little frustrating because, I mean, we didn't qualify for the nonprofit emergency relief because we bill for clinical services. We couldn't apply to the healthcare, the provider relief fund because we're a nonprofit. So, you know, I've been writing grants for twice as many grants this year as I have.
Mhm.
And that's been the issue. So now what's happening is the CARES money, there's still a lot of money that has to be dispersed by December 30th. So they're coming out with round 1, round 2, round 3, where little by little they're loosening the hoops and
Making it
hurdles.
a little easier.
But up to this point, we haven't received any of that funding. Been frustrating.
Yeah, so you won't know till December, yeah.
We know that there is one grant that's pending that is supposed to provide us with up to 2% of our Medicaid, all patient revenues.
Mhm.
Because we took a third, I mean, our volume of patients when COVID hit dropped by 30%.
Mhm.
And that's a huge hit financially. So, but we don't know how much that's gonna be. We're hoping it would be $150,000, which would equate to 2% of our patient revenues, but who knows? They haven't told us.
So, question, I know we went back and forth and it's been, so the last year you turned a profit and were profitable was last year, correct?
Yeah, I mean, I'd have to go back and look. I don't have all of the
Okay.
year-end financials, but if you look at the statement of financial position for the period ending June 30, it does show a small, in the financial statements, it does show a small,
Deficit there, yeah.
very small deficit. So it bounces
So
around.
it's just like, so you didn't make money last year.
No, if you're talking about fiscal
So you're
years,
just, are you
remember,
guys separating? So basically, we're giving money to a separated account for emergency services. And that's all you guys are asking for on that account. Even
yes.
though there's way, just because it might come from our taxpayers. That's how you guys want to justify this $3,000 you're asking for, I guess.
No,
Okay.
we're asking, the money that all the towns, when they submit funding
Mhm.
to support emergency services, those are restricted funds.
Mhm.
They're used to offset the deficit to provide emergency services
Mhm.
to residents in our catchment area.
That's if the residents can't have the inability to pay, there's a deficit. Correct.
Well, if we don't get paid, sure. I mean, obviously, that's part of the deficit. That's why, you know, it's over $1 million to run the program, but $500,000 was in revenue. There were a lot of people that can't pay their bills
Mhm.
simply because of the situation they're in. We're going to serve them anyway.
Okay.
We have to. But it's the money that is used to offset that deficit or part of that deficit.
Okay.
So each town's ask is based on their town's population. So it's equitable ask for all towns.
Cool, thank you.
Christine, are you listening? Do
Yes, I am.
you have any questions?
Just a quick one, maybe to add on to Dick's. If you don't get these monies from the town, are you going to be looking at layoffs?
No.
Okay.
We're not laying off anybody, nor have we.
They can't attract the right talent pool. to stay there quick enough. So they're hurting.
Yeah, I heard that.
Not that at all. It's that there are people coming out of college of choosing not to go into the mental health profession, period.
Yeah. That was it, Catherine.
Okay, do we have any selectmen joining us in this meeting besides John? That have any questions? No? How about public? Hello?
I don't see any on there.
Nope.
I don't hear anyone. Okay,
Well, I'm
Tim?
public. Yeah,
okay,
I just wanted to say that I've known someone personally that's made use of the services and was done so by a very talented and caring group of people that were in difficult circumstances. So I know it may not be, I'm not speaking from the financial side. I'm speaking from the support side that I think sometimes as a citizen, we choose to, to all sort of chip in. And I guess that's how I view, it's a very difficult situation working with people that have mental issues, and from what I saw, it was very well handled and very difficult. And I just wanted to say that as a citizen, I appreciate the fact that they're there, with or without the financial support, and that it is a very vital service for the community, and in my estimation, as a private citizen. Thanks.
thank you, Tim.
Thanks, Tim.
I have one question. You indicate on your application that your services are going to increase for our residents, but I see, how will it increase? Because you're looking at emergency services at 24/7, and I don't know what the other services are. So how will there be an increase if you're already 24/7?
Well, the increase would come from individuals who may need services and are not able to get services for whatever reason. And I'm talking about short-term services, which can be situational in nature, or it can be because of a longer-term illness. So we offer short-term services and long-term services. If people don't enroll in those services when they need them, oftentimes what happens is the person becomes more ill and has suicidal ideation, can be homicidal, can threaten to hurt self or others. And so that's when they become an emergency services patient. They could be brought in by a police officer, by first responders, be brought in by a family, or they could self-admit. So that's the issue, is keeping in mind that with COVID, a lot of people who have lost their jobs have also lost their health insurance. So a lot of folks are choosing not to get health care when they need it, and that includes mental health care. So when things go on for a while, then that can become an emergency situation. So that's why I predict not only increase in ES, but in total patients
Thank you.
over the long term.
So how will your hours increase?
Well, because of we're working 8 to 5 right now, but we can expand into evening hours. And that's what we're doing now because of demand.
Because you have emergency services, which, like I said, we're 24/7.
Right, but there's oftentimes patients that need services that can't come in during the business day because of work
Oh,
or
okay,
because of school.
I see.
So yeah, once the kids come back to school and are in classroom, we expect to see evening hours to be increased for children as well as for adults and families.
Okay,
I thought kids were back in school for the most part.
It varies from town to town.
Yep.
Some of them are 2 days in, 3 days
Hybrid.
out, or,
Hybrid programs or.
we're, I'm sorry. Time to shut the door and let you complete.
So it does vary.
Tilton is the hybrid.
Yeah. And there's a few, charter schools that are full-time in person, so.
All right, Anybody else, any questions? We good?
I'm all set. Thank you.
Thank you so
All
much
right.
for coming in. And
My
if we,
pleasure. Thank you. It's nice to see you all again.
it's good to see
Okay,
you.
thanks.
If we have any more questions, we'll have.
You know where to
Janice.
find me.
Yep.
Okay.
Take care, Ann.
Thank you.
All right, Casa.
I believe someone just came in as a caller. It might be Ted.
Yes, all sorry. I've been really busy with work. I apologize for the late join.
I didn't hear any of that. Did anybody else? hear?
Groveling.
Yeah, he'll apologize. He's just leaving work, I think he said.
Ted, are you on with us?
Yes, can you hear me?
Yeah, now we
I
can.
now. Hey, how are you? Welcome.
Tired.
If this is the end of your day. All right, we have Casa with us. Go ahead.
Oh, awesome.
Thanks for having me. My name is Julia LaFleur. I'm with CASA of New Hampshire. As you may know, CASA stands for Court Appointed Special Advocates. We serve children throughout New Hampshire with advocacy services through our volunteering network. Last year, we served over 1,400 children across the state, and they were served by 630 volunteers. CASA is mandated by the court to serve children who are in situations of abuse and neglect. If for some reason we cannot provide a CASA volunteer to serve for an abused or neglected child, the state then hires a paid guardian ad litem at a rate of $60 per hour plus travel costs. So with that estimation, we determined that last fiscal year, we served the state about $4.6 million in advocacy services. Our volunteers come from all walks of life. They go through a rigorous 40-hour training. They receive support services throughout the year. We estimate that it costs about $1,460, so that's $1,460 to serve one volunteer per year. And then in turn, that volunteer serves about 2.5 children on average. Our children come from every town throughout the state. Last fiscal year in Tilton, we served 35 children. And so that means that that child was either removed from a home in Tilton or is living in care, in someone else's care within Tilton. So that could be a relative, that could be a foster family, or that could be a parent. Let's see. We are asking for a slight increase this year, $1,500 from the town. That again would support one volunteer throughout the year. So that volunteer could potentially serve about 3 children within the town of Tilton. We did see a pretty sharp decrease at the beginning of COVID in cases that were reported to the state. It was about 50% through March and April. We are starting to see that pick up a little bit now that children are somewhat back in school. They're being seen by their teachers, more reports are happening. But it is problematic for us because we anticipate that there's going to be a very large surge of cases within the next year as children start returning to school more often. We are finding some solutions to get around that. We're working with law enforcement who are making house visits. And of course, we have our volunteers who are still working with their children and, assessing their situations.
Could you pull the microphone closer to you, sir?
Sure. Is that better?
Much better.
Okay.
If you can just give it a
Sorry.
little,
Yeah.
Pick that up.
Absolutely.
bam, there you go.
Okay.
Now you cook them, Jen.
Thank you.
You're welcome. We are, facing a little bit of a decrease in our funding because all of our fundraising events, which we estimate raised about $900,000 last year, we had to cancel. We have gone virtual with a lot of these things, but it's still not going to be the same profit for us this year. So We are increasing our ask to grants for federal funding. We did receive some PPP funding, which we have applied to be forgiven, but we have not heard about that yet. Do you have any questions for me at this time?
Yeah, are they volunteers or are they paid work? I'm just confused. Or is it volunteer paid, like paid volunteers?
No, so our volunteers they give all of their time. So that means that, you know, they drive. We don't reimburse them for anything.
Making sure that was clear, because I know we were talking about the adding guardian items and then.
Right.
I was just looking at your profit and loss. First column, it says 7/1 of 20 through 7/31 of 20. That must be a typo, right? This page? Anybody else?
Yes, I do.
I think that was the most recent. Yeah, it looks like they added in our first month of the fiscal year. I'm not sure exactly why. The annual budget, of course, is right next to it there for 2021. And that would be fiscal year.
Yeah, it looks like, you know, it was just 1 month alone had $360,000. That's why I'm wondering, is that over the year, fiscal year between? Is that fiscal?
I think that's.
Oh, I maybe I'm missing it. Let me
I
see that
can
page.
certainly ask our finance manager.
I'm looking. Hey, let's see, look in the book. Is that July 1? Wait.
Oh, that page, do you?
2021.
Right.
Do you have that page you're talking about? 'Cause I'm looking for it.
I'm looking for
Yeah, let me,
Kind of
Let me
propaganda
ask
you
her.
do.
yeah, I'll
Can I
let
see
me
that?
ask her and I will
What is that?
certainly.
Propaganda you do.
It should be about the 5th page in or
Oh, yeah, I
so.
don't have this one at all.
Yeah, it should be, if you look,
Maybe I do. Hang on, let
you
me
have the
check.
orange section.
Yeah. So I'm
And I
in.
believe it's the 5th page or 2nd page.
Yep, I got it. Never mind.
Okay.
Hold on. There you go. Thank you.
Yeah.
Is there a
There
page
you
number
go.
on it?
Oh,
Yes,
it's stuck together.
Okay, let me
I don't think you can
get
get
a
it.
confirmation on that, if that's okay.
Okay.
I can certainly send you a revised one.
What was the line, the 200,000 one?
First column,
Yeah.
the dates, 7/1 of 20 through 7/31 of 20.
Well, yeah, that'd be a short. stint,
Yeah. It's pretty good, $360,000 in 30 days. So I'm going to guess that's a total month. Fiscal. I don't know.
Would our funding, not funding you affect any services at all?
Well, yes, certainly. I mean, we're really reaching out pretty wide right now for funding sources, because we have, you know, seen a loss with our fundraising events.
So this $1,500 will make or break or lose jobs for you, and it'll affect your services greatly.
$1,500 will, yes, I mean, it will support one volunteer. I mean, we need all the volunteers that we can get right now.
How would it support a volunteer if they're not getting paid for anything?
So $1,500 supports one volunteer for a year.
How does it support them?
Yeah.
Is it just, are you compensating for training?
For
Okay.
training and support throughout the year.
I'm okay with the training, but what's the support mean?
So support means they may have a workshop or additional training that.
It's just training.
Yep.
It's just training.
It's mostly training. You know, we do have additional volunteers who kind of act as mentors throughout the year with our active CASA volunteers. So it's support services, yes.
Okay. So the total working budget for this year was what, 800,000? Oh, no, sorry, I was wrong. it's 4 million, or that's your total assets. $4,237,366.33 is your total assets, and $1,500 is make or break. That's what you're telling me?
Well, not exactly.
Well, that's what you said. That's what you just said to me. So
No,
I just want to be super clear, because this money
Sure.
can literally push somebody out of their home that's on a fixed income. We've spent a ton of money in this town this year,
Right.
and we need to be responsible. These are elderly people. These are people at high risk. These are people that are in danger of losing their homes or are already in that area.
Right. And yes, and we understand, and that's why we try to spread our reach, across the state.
Just a few dollars a month could literally push somebody out of home. So that's why I said, would this really make or break services?
I mean, yes and no, and I'm sorry to be vague like that. What it would do is it would prevent potentially 3 children from receiving services within this town. So those are 3 children who are being abused, neglected, and now we cannot provide for them. So then the state hires a paid guardian ad litem at a much higher cost than it would be to.
So the state would then assume this cost.
Well, and taxpayers.
Okay. But the child wouldn't be without that service.
No, the child would certainly get a service. It's important to note that, our passive volunteers are sought out first because they're able to provide so much more for these children. They're required to meet with their kids at least 4 times a month, which, a paid guardian ad litem may never even meet their child if they're representing in court. So the quality of services that we're able to provide for these kids is much greater. And in that, in that perspective, it makes sense. I don't know if does that answer your question?
No, just vagued it up. So what I'm hearing is that it would not affect services, but you guys would still like the money. That's what I'm hearing. It's like it would not affect the bottom line services that are going to be served. You guys offer a more comprehensive service. That's great and everything. But at the end of the day, the guardian ad litem service would not be greatly affected or at all affected.
Well, it would be one less. It would be one less
Option,
yeah.
but they would still have the service provided.
Well, and then it would additionally cost more for taxpayers to hire a paid guardian ad litem.
John, anything else?
No, I'm all set.
Christine, do you have any questions for Costa?
Nope, I'm all set.
Okay. Normally, I know in the past you provided us with the amount of money that the other communities in Belknap County.
Sure.
Could you get that to
Absolutely.
Janice for us?
Yes.
Thank you.
Yeah, and so that was amounts that you received from those communities.
Yeah, how much funding
Okay,
you request
sure.
and then they give to you. I say Belknap County, but if you could include like some of our sister communities, Northfield and Merrimack. Gonna get others they want to add besides Belknap County?
Nope, that's fine.
Northfield?
That'll be good for next year for
I
sure.
think so.
Okay,
Definitely help next year.
All right, thank you.
great. Thanks so much. Appreciate it.
Thank you.
Have a good night.
Thank you so much. Have a great night.
Oh, Ted, I forgot about you. Did you have any questions?
No, it's all right. I did not. Thank you, though.
Sure. I'm gonna write your name down.
Thank you.
Hey, Catherine.
Yes.
Yeah,
Yes.
I just offer a comment, and I promise, I'm not going to chime in each and every time, but I happen to be a foster parent for 5 years, and so we had a lot of interaction with CASA workers and just incredible people, very dedicated to the children. There was one fellow who he was about 15 and had been in foster care for some time, and this woman who was probably in her early 60s. She had stayed with him for years and visited him, went to all his birthday parties, in addition to all the court things, brought him presents, really took an interest in him. And, just it's one of those things that no one would ever see, but it's such a great program. Yeah, again, I'm not going to speak to the financial side of it. That's decisions for you guys to make. But I just wanted to say, as someone that had had direct interaction and contact, it's just it was really one of the most meaningful groups I've ever come across.
Thank you,
In a
Tim.
group.
Sure.
Thanks.
Being me, was I was in foster care when I was a kid. It's a great service.
Thank
Really
you.
do great work. Thank you.
Thank you very much.
Okay, Pines Community Center. I forgot the public too.
Oh, look.
I'm used to them sitting in front of me.
Yeah, let's do it. Pines Community Center.
Hello, how are you?
Good, how are you all
We're good.
Good to you guys are hanging in there, you know, like you haven't left,
Absolutely.
not anywhere else, or doing a good job.
Thank you.
Good growth, appreciate it.
Thank you.
Where is that in
All
here?
right, go ahead.
My name is Brittany Stewart. I am the Executive Director at the Pines Community Center. We offer a variety of recreational programming for all ages for the towns of Tilton and Northfield. We are a licensed childcare facility through the state of New Hampshire. So our before and after school, summer and vacation camp programs are all licensed through the state. 2020, obviously for us, has looked a lot different than any other year in my time at the Pines. With the schools closing in March, we consulted with other recreation departments in the area, including Franklin and Samberton, and took into consideration the safety of our participants as well as our staff, and made the decision to close. We remained in contact with the other local departments. We reached out to the CCLU, which is the Child Care Licensing Unit, as well as the Department of Health and Human Services, to kind of draw up a plan between myself and Samantha, our recreation director, of how and when we were going to reopen in a safe way. The CCLU and DHHS was urging licensed facilities to reopen to provide emergency childcare for essential workers. So unfortunately, early on, due to staffing and our not being able to assist with the remote learning with the kids, we were unable to open, but we did apply to be an emergency childcare provider. We were approved in May. We reopened on June 15th, which was a week ahead of when we were normally scheduled for our summer program to start. We transformed our facility into 5 classrooms, if you will, in order to keep the kids separated. And we ran the program for 9 weeks. We closed for a week for cleaning, and then we reopened for an additional 2 weeks because the Winnisquam Regional School District is now starting after Labor Day, as opposed to previously when there used to be just a small, usually a week gap in between our program and when school would resume. We've been open for before and after school care, which we've run extended hours for that until they're now back on their cohort days in school full time. We're also open on Wednesdays from 7 to 5:30 to provide childcare for parents. And we are looking into basically bringing our internet up to speed, if you will, to potentially provide remote assistance, at least to start on Wednesdays. I'm not certain how long, obviously, this model will last with the district. But the only other program really through the summer, we did offer a Zumba class outside, but as you can imagine, it's been challenging for us, especially with the kids in the building, and some of the populations that we do serve are more at risk. So those programs, we have a lot of folks that are apprehensive, but we did start this month to bring back some of the groups, or allow back some of the groups, I should say. The Girl Scouts, the Cub Scouts, the evening groups. We've revised our building use form to kind of adhere to some of the guidelines with COVID, but it's been a very different looking year for us, unfortunately, programming wise. We've unfortunately missed out on a couple of our largest fundraisers. You know, And we're just hopeful moving forward. We're trying to be creative with our programming. October, we have multiple events, community events that we usually host, pumpkin carving night, a Halloween party. But we're trying to be a little bit more creative. We're going to do a virtual pumpkin carving activity, or contest, I should say, a virtual costume contest where people can submit, the photos. And then obviously moving further into the fall, our hope is that we'll continue to take steps towards, I guess, normal, if you will. And I think right now we're in a position where we do need to be and have to be and have been creative with some of the program that we normally offer, being that obviously this pandemic is ongoing. So, but our hope is obviously going into 2021, our hope is to be able to resume, and they may look different, but a lot of the programs that we would normally run through the entire year. So.
How has it affected, sorry,
Go ahead.
So how has it affected you during the COVID pandemic, just as like retooling compared to being always in person to going online? Does it cost you guys a lot of extra money or time?
I mean, obviously with the closure, our before and after school programs are consistent every month, 35 to 40 kids, 20 to 25 in the mornings, where we have that income that we rely on. So obviously, we did miss out on that, and we do have a lot of kids who, our program numbers are down because a lot of parents are either home working and they're able to, be with their children and help to accommodate with the remote learning because they've been doing it obviously since March, some of them. And we have other kids who parents just don't need the program until the kids go back full time. So our numbers have certainly been down. And we are seeing that in obviously, our income. I know that, and I know I provided this to you guys, that we did, right after we started the summer program, we had applied for the Paycheck Protection Program. Obviously being closed for 3 months, we weren't certain what our financial situation was going to look like. We're bringing on a staff that normally with half capacity, which is what we were taking in obviously for kids in order to adhere to the guidelines, you'd think, well, half capacity, fewer staff. Well, when you have to keep the kids separated for an entire day when you're open from 7 to 5:30, it's not that easy. So we had to work around that, and we carried similar numbers staffing wise to last summer, when we were running into issues where staff's traveling. Well, out of state, now you're gone for 2 weeks. So a lot of bumps in the roads here and there that we, had to kind of work our way through. Yes, so the Paycheck Protection Program, that was to ensure some financial stability through the summer so that, we're in a position where, yes, we can pay our staff. And then I know that I did note that.
You did get the Paycheck Protection Program? You got that 36,555.
Yes, we did. Yes, and I'm currently in the process of working on the forgiveness application. We received that shortly before we received notice of the CCRSP grant that we received, which is the Child Care Recovery and Stabilization Program. I want to get out. That's through the Department of Health and Human Services. When I found out that there were funds available to emergency child care providers, I went through the application process. It was just another means of making sure, because, obviously there was a lot of uncertainty if we were going to be shut down again. The profit loss we would have incurred from that. We had several, obviously, children withdraw from our program. So that was something, that, we lost that money out on. Obviously, we were funding parents. But the CCRSP, like I said, we received word on that. When I initially applied, we were not asked to provide a specific dollar amount. We were providing information to them, profit loss that we'd experienced. They were working for quite some time on formulas. So we weren't certain what kind of funding we would have been able to secure until they sent out that information, which was, like I said, shortly after, within a week of us getting the disbursement for the Paycheck Protection.
So you're asking for $69,750?
Correct.
Cool. And that's an increase from last year from how much? Do you remember?
2,500.
2,500?
Yes.
Has it costed more for PPE and stuff out of pocket, or have you guys got that all in grants?
So the CCRSP grant is specific to, yes, COVID-19, any supplies necessary. And I mean, I've even included obviously the things that we needed to transition our building into 5 separate classrooms, which means separate supplies, separate equipment, separate everything, if you will, over the summer. So, and even now with the before and after school, the separate classroom spaces that we have going for them. So that has helped to, yes, offset those costs,
Awesome.
as well as some of the profit loss, thankfully.
Very great program. You guys do an excellent job.
John?
No, I've read through a lot of stuff.
Christine, do you have any questions?
I don't, thank you.
Ted?
None. Thank you so much for coming in tonight.
And the public? Any public? No? And we don't have any more selectmen on.
I'm here, but I don't have any questions. Thank you. This is Pat.
You're welcome. All right. I guess we're good.
All right, well, thank you all.
Thank you so much.
Yeah, thank you for sticking it out. I can't imagine keeping masks on all those kids.
Well, when we started our summer program, we actually had obviously consulted with the other departments, and the kids weren't wearing the masks. I mean, in the heat, our staff had a hard enough time. I had a hard enough time. I was switching out my mask 3 times a day at least with sweat. And
Yeah.
so during the summer, the kids didn't have to wear the mask. So getting on the bus with them. So.
Yeah. All right, well, thank you.
Thank you so much.
Thank you all for coming in. Good to see you.
Can I quickly say something?
Absolutely, go right ahead.
So with this extra money, I know with money and employees and whatnot, she's done a wonderful job. There's no complaints on our end as a board. She does, I would not want her job, but with all the, we're pretty run a tight ship. So with any extra type of money, as a board, I can speak for myself and Rose, I'm sure, we would love just to give her a little extra and her workers a little extra.
Absolutely.
What she does and the workers do down there is phenomenal. I couldn't do it. But we're going to do what they get paid. So
Great note.
we need to keep good health. I'm a firm believer of keeping good health. So we definitely like to give a little extra. So,
You don't want to start all over again?
no.
Thank you all so much.
Thank you.
Thank you for coming in, and thank you for what you do. Have a good night. All right.
So we question a little bit. I know last year we talked about voting after every night on stuff. Are we not doing that? Or are we going to keep up? Because we do have.
I don't know, what would the board like to do? Do we want to wait?
I would say vote.
You want to vote tonight
I would say
on
vote.
these
Yeah.
three?
I say wait.
You
we
say
did-
wait,
We
Ted?
always
I'm
waited.
in favor of waiting as well.
John?
First of all, I know one of them we're waiting for the P&L, the updated P&L. So obviously, that's not ready, but I'm not comfortable voting until later.
I thought we were waiting for that for next year.
Waiting for what?
Oh, she is going to send it corrected. Okay.
That's what I'm not saying.
Okay. Well, why don't we do this as a compromise? Instead of voting tonight, why don't we vote for these three next week?
As long as we're not going to be waiting like last year.
Yeah, I don't want to
It was
wait.
complete chaos how we've been doing it.
Yeah,
We need to
so
do something different for sure.
what do you think? If we vote for these three agencies on their request next week,
Okay.
while it's still fresh in our minds?
Well, some of the things are our municipal budget coming in and what we're going to have, what we're facing for our own funds availability.
Yeah.
That, there's a lot of expenses that aren't going to be covered or anything by, some of our COVID reimbursements, as well as, what our tax is going to look like. So I'm
Yeah.
concerned that if, we go and say, yeah, we're going to do it, and then we find things are all tight.
It can be brought back up. Ted and Christine, what do you think of voting next week for the three agencies we met with tonight?
I'm done. I'm okay with that. I think it's a good idea.
Christine?
Well, it looks like I'm the minority. However, I'm, in the middle of a specific tax season, so it's a little difficult, but if we have to, I guess we have to. I would prefer waiting till the next one, but that's just me.
All right,
Well, we
well,
have the meetings every year at the same time. So.
So,
I'm aware of that, Dick.
I forget that they extended that for you.
Well, no,
Oh.
October 15th is every year. It's everybody gets extended if they don't want to file in April. They only extended April to July, which made me have to work twice as hard all year. So
Good Lord. All right, so we've got information coming from at least 2 of the agencies, right?
Which one was the other one?
Just the CASA?
Oh, the discrepancy.
Yeah, just the process.
Okay, so just one. So let's bring it up next week. If you
voting
get
next
that
week, yeah.
information, can you email it out to us
Oh, absolutely.
as soon as
I'll
possible?
make sure I follow up.
Okay,
We're definitely voting next week. We'll try to keep that. We should just make a policy. I think it'd be good every
Well,
week if we made a
yeah,
policy.
I mean, hopefully
Just-
next week when we're all sitting here, we can discuss it further. I, for one, while it's fresh in my mind, like to vote on it, because sometimes I mix them up, like,
Mhm.
you know, we get similar services from 2 or 3 different
Exactly.
agencies, so it's easier for me personally.
Exactly the
But,
chaos that we had last year
yeah, I don't want to wait
and the year before.
4 weeks, but let's bring it up next week and we'll kind of plan on it tentatively. And if the majority of us say yes, we will. And if they don't, we won't. That's how it works.
Just for clarification purposes, I have, CASA have the typo, what John thought was a typo, and she's gonna clarify that. What was the other one?
I asked CASA if they could give us the list of the communities in Belknap County,
Okay, yes.
the amounts requested, the amounts paid, and included Northfield in that request because it's a Merrimack.
Thank you. Thank you.
You're welcome. All right, where are we at? I wrote on my agenda.
Whoever's talking at the mic in the back, we can't hear a word they're saying.
Oh, it's Janice.
Hi, Pat, that was me, Janice. Basically, I was just asking for a clarification for the other question that needed to be followed up on so that I can make sure that we get the information as quickly as possible.
Hey, Janice, this is Tim. The mic that's back there, you have to speak directly into it. If you don't hear yourself in the room, you won't be projecting.
Like 8 Mile.
Is this any better?
Much better.
Oh, that is, wow. What a
Much
difference.
better. Thank you.
Better get one of these
Glad we got
fancy
that sorted
ones.
out right before the end of the meeting.
All right, I don't see any correspondence, any other business?
Yes.
John?
The Hartwell, the concert series, the concert series, as I think everybody is aware of what happened with Alice. And I don't think it's necessary to require them to come in. We have the financials. We have that. They're asking for $2,000. The amount that they raise selling burgers, chips, sodas, and all that to help benefit and offset the cost of the senior center was just phenomenal. And
Just a quick note about the Island Concert Series. We do want to keep in mind, I do think that we should fund this year, even though they didn't come and they can't come, obviously, because certain circumstances.
yeah,
But I just
that's
do
what
want
I
to.
was getting to.
Yeah.
So if I could finish
Oh,
it up,
sorry.
you might have to.
Yeah.
wait a
But
second.
my thing is
I'll
that
make it
we
real
were.
quick.
Sorry,
One
I'll
at
let
a
you
time.
finish.
Please.
And so I'd like to make a motion that we do fund the Island Concert Series for the 2021 to the amount of $2,000.
Before we do that, though, I just.
Well, let's get a second and then we'll discuss, okay?
Oh,
Ted, did I hear a second?
Yes.
Thank you. All right, discussion.
Before we approve this, or just jump home and go with this, just remember that last year we did have multiple sponsors willing to pay that entire amount, and we kept the line open. You can check the record because it was just to keep the line open. So I just wanted to make sure that we just kept that a note, that we did have sponsors to pay for that, and we could have eliminated that line altogether.
Are we certain that the concert series is going to go forward?
I can answer that.
Okay.
I had an opportunity to talk to Titus for
Oh, you did?
a while
Okay.
on it. Right before Allison passed away, she actually went and set up and booked the bands for next year.
Ah.
Titus informed me that a lot of the sponsors that they had mentioned last year they were going to have actually backed out because of funding and money and all that. And they did pick it up personally, their family, the Harpo family, to cover for the sponsors. He's not certain if what sponsors will be in for next year,
Okay,
but he's hoping.
Sorry.
I think that might answer.
No, the sponsors were totally different. The sponsors that were willing to put it up, they never actually put up the money because we refused to take the money for them because it would eliminate the line item. That was the actual deal. We can look it back on the record. We can bring that back up with those individual sponsors, but I don't want to advertise their business for it. But there was sponsors. They were willing to put up the money, and we did not take that money. We would rather take the town's money. That was what we chose to do last year.
May I say something?
yeah,
We take 2,000 from Tilton and 2,000 from Northfield, and then there are a number of different sponsors throughout the town of Northfield, Samberton, and Vermont, the businesses that sponsor the other bands that come in. So it's not just $2,000 that cover the cost of the bands throughout the summer series. It's way within the $20,000 range that the cost of the bands. Those are covered by other businesses. Franklin Savings Bank, Rotary, there's a number of different and individuals as well. So the only two towns that actually sponsor individually is Tilton and Northfield, and they have for years since the inception of the concerts. Then that's 20 cents. It's going on the 28th year.
Want versus need.
yeah, according to the financials they gave us, they get $7,000 towards
Yeah.
the projected income for the bands. The bands are 9,000, they get printing at 6, advertising at 9, event insurance 6, for a total of $11,100.
Yeah.
And we
And then they're gonna contribute $4,100 to make up the difference. So,
to look at the record. Yeah,
Maybe you could
go back and look at the record for sure.
okay, Ted,
I remember
Christine,
trying to,
do you
but
want to
no
add
listens.
anything to this conversation?
No one listened when I tried to say that we had sponsors and they just turned away because we'd rather fund it ourselves. So that's all I wanted to say. On
Ted,
the record.
Christine,
No, I don't have anything. Thank you, Catherine.
you're welcome.
I don't
Christine?
either.
Okay,
I'm all set.
I think the concert series is a great thing, but I think Dick makes a good point. There's 1, 2, 3, 4, 5, and then it just says donations 500. So there's 5 agencies besides the towns that contribute. Well, actually, there's 2 families that contribute. So there's Gale Insurance, Tilton Northfield Rotary Club, and Tilton House of Pizza, the 3 businesses that contribute. So Dick makes a good point that,
We turned away other local businesses
yeah,
that are
we're
in the
turning
town
away
that
other local
they're willing to do
businesses.
it and sign a contract for 5 years even to just remove the line item. And we would just move around. Again, we can go back to let the history speak for itself. Let the
Yeah,
people's voting
I'd like
history
to,
speak for itself.
If you got the opportunity. maybe you could show
Oh, I'm not your assistant that does things for you, but you can totally go. Because I remember you were here.
You're making claims that I'm unaware of. Check.
All right, go check it.
So if you have any information, just,
Our in-depth minutes that were done to high quality before. But a vote to
All right,
adjourn.
we have a motion on the table to fund the summer concert series in the amount of $2,000, 2021. All those in favor, please signify by saying aye.
Aye.
Ted, was that an aye?
Yes.
And aye. Opposed?
Nay.
All right, so we have 4 ayes and 1 nay. And would you make sure on the minutes that we had this discussion about the businesses that sponsor it?
Please do. Make sure it's in good detail, please. Because sometimes it gets left out of the minutes. And we
I
have
think
this
that's
issue.
important. important.
Absolutely. You do a great job. Thank you. Motion to
All right.
adjourn?
Read my mind. Is there a second anywhere?
Second.
All those in favor?
Aye.
Aye.
Ted?
Aye.
Thank you. All right, everybody, thank you. Good job. We'll
Thank
see guys
you.
next week. You guys take care. Good night.
You too.
Night.
So,
Yeah, please make sure that my name is Dick Olson and all the
I
names.
will, yeah.
All right, cool. Thank you so much.
Sorry.
I appreciate you trying to be polite, but
Janice?
Yeah. Oh. Want me to close the meeting?
Yeah, end the recording and close it.
Shut her down. So there's a